wow, this is a real beginning of a revolution.
Significant drop in funding. I wouldn't be alarmed just yet.
Seeing the rise of technology in healthcare, whether it's, the Oura Ring I have, or the Apple Watch, or the even the glucose monitor I wear to monitor sugar, or all kinds of tech.
It looks like the pandemic of COVID has stopped in our country on February 24th.
Pandemic is over, so is telehealth all done now?
Frankly, even the big tech brands aren't particularly good, many of them, at social media.
There is always a why behind a founder or co-founders or executives at the company, at startups in healthcare.
In marketing is all about storytelling and content creation, and the future belongs to content creators who can communicate at a human level. And hey, it's Evan Kirstel and Irma Rastegayeva of eVira Health with Alex Koshykov of actually in the Ukraine at the moment. And I really wanted to have this conversation live and not recorded to get a feel for what's happening on the ground, both immediately and a little bit more about what's happening with this healthcare and health catastrophe that's unfolding in Ukraine as well. So welcome, Alex. And I won't ask you how you're doing, but how are things going? Maybe more appropriate conversation.
Hi, everyone. This is a great question. I'm originally from Kharkiv, Eastern Ukraine, which is really close to the war zone. I spent first 6 days after February 24th in Kharkiv in my house basement with my wife, my little kid, who was at that moment 4 months old. Now he's 6. And with my mom and my mother-in-law. So my whole family basically spent most of the time in the basement for the first 6 days. And the day when the super jets started flying just above our house, that was like, that's it. We have to leave. In the beginning, we were thinking there is a small chance this may end soon. But after that, we realized, oh, this is not going to end soon, and it's going to get only worse. So we basically got all the stuff we needed, jumped into the car, and moved to Western Ukraine, where we are right now. It's fairly safe. They're still bombing Western Ukraine once in a while, mostly Lviv, but it's definitely much safer than Eastern or Southern Ukraine right now.
Well, it's so terrifying and traumatic what you and your countrymen and women are going through. And that isn't necessarily the focus of our discussion, but I did want to really honor you and the people of Ukraine and your struggle. I know, Irma, you were born in Kyiv and emigrated, I think 30 years ago this month, maybe. Is that right, Irma?
30 years in February. So born and raised in Kyiv, Ukraine. And anywhere I've traveled in the Soviet Union, I always felt like Ukraine was the most beautiful city. I could never find a more beautiful city. I loved living there, but we immigrated with my family because things were kind of falling apart a little bit after the Soviet Union fell apart and Ukraine was independent. There was some nationalistic movement, and things were not very safe for Jews. And unfortunately, now with the war in Ukraine, I'm hearing some of that as well, anyway, this is not a focus of the conversation, but yes, I've been here 30 years. And when the war started, I did have some family in Kyiv, and it was very nerve-wracking. And actually, through the power of networking and social media, I was able to find some people that could help them evacuate and leave Kyiv, and they're now safely in Europe outside of Ukraine. So while my own family is safe at the moment, my heart really bleeds for everyone else in Ukraine and the horrific catastrophe that is catastrophe that's really happening there on the ground. It's just it's really unbelievable. It's who thought that we could have the war in the heart of Europe in 2022? It's just horrific.
So, Alex, tell us before the war, before I think your company, you said, was even bombed, the building. Tell us about your background and your work in healthcare and digital health more recently.
Yeah, I've been working in multiple software development companies. And more than 5 years ago, me and my partner, we decided to start our own company. And it turned out to be that most of the experience and expertise we had was in digital health. We worked on multiple projects with big companies like Medtronics, Rite Aid, American Heart Association, and others. And there's definitely lots of startups who work with creating the MVP version, the prototypes, and their products itself. Right now in our company, we do focus on startups mostly, and digital health, of course, is the most interesting industry for us at the moment.
Yeah, before the war, it came to Irma and I's attention that there was so much innovation, software development and testing and IT services in healthcare and digital health happening in Ukraine. We were just really amazed to talk to companies and how, what do you hear? How is that holding up? You have so many developers and engineers and technologists and everyone else who's been disrupted. How is that important work? Is it able to proceed at all under the circumstances?
Well, I guess thanks to COVID-19 for the past 2 years, we kind of got used to remote work before. So yeah, even though we still had an office in Kharkiv, which got bombed several weeks ago. But yeah, basically when the war started, most of the employees got their laptops and tried to move to a safer place. So the companies working, the whole IT industry, I think is the most safest place to work right now because people still can work. And I think this is a great help to the economy of the country because somebody has to pay taxes even now. Somebody has to sponsor buying the equipment, supporting the healthcare system and stuff like that. So yeah, we're working. We continue to give all the services to our clients, and that's good. That's good for sure.
Yeah, that's so important. And one of the things that's not talked a lot about in the war is the effect of the war on the healthcare system. It's a catastrophe in so many ways, but particularly on healthcare. I mean, I can't even imagine where to begin. What say you in terms of how to navigate through not just a war, mental health crisis, but a healthcare crisis, and how the country will navigate through that?
Well, I have no idea what kind of impact is going to bring to the whole healthcare industry of the country after the war ends. But right now, you're correct. It's a catastrophe. Lots of hospitals got bombed as well. Lots of private clinics were closed because people are not they don't have enough money right now. They don't want to go to the clinics unless that's an emergency. So, and basically, the funny thing that looks like the pandemic of COVID has stopped in our country on February 24th. And because before that, we had all the stats every day from our health ministry saying like how many people got infected, how many died and stuff like that. On the 24th of February, all of that stopped. The priorities changed in the country. I'm sure people still get sick, but right now, really nobody cares about COVID, about the pandemic. That is why we don't know what's going on in terms of pandemic in the country right now. But yeah, thanks to other countries and partners, they give us a lot of help, a lot of medical help as well. Like countries send some doctors here, send lots of equipment that we really need, but it's definitely a huge problem.
Yeah, it's hard to talk about digital health and tech when people need food, water, medicine, weapons to defend themselves. I mean, but are there any examples of digital health or apps that people are using that you've seen that kind of can help in any way?
I have a perfect example. Like 2 weeks after the war started, my company has launched a telehealth platform.
Oh, wow.
It's completely free for all Ukrainians, not just in the country, but for refugees as well who left the country. Doctors from all over the world, of course, Russian or Ukrainian speaking doctors, are volunteering and dedicating their time to consult and help Ukrainians online. And this is huge, I think, because I didn't know the stats before. What's the percentage of the population of Ukraine used telehealth before the war had started? But right now, it's definitely going to increase. For lots of people, it's the only way to get help. Especially people who are in the shelters, in the basements, they need to get some consultations. And we can see that how many people got to our platform and using it right now. It's called Doctors for UA. And I really hope the trend is going to stick after we win basically in this war. So I'm happy that technology is actually here to help Ukrainians in such difficult circumstances.
And this was your company that launched this app?
Yes.
Oh, that's fantastic, Evan. So Doctors for UA, we should help them promote this so that more doctors could volunteer their time. More Russian, Ukrainian speaking doctors can volunteer their time and help people. This is yeah, that's fantastic.
Oh, great time, money. I imagine there's pharmaceutical needs and medical devices, and a lot of people probably don't even know how to give or contribute in those areas. So we'll talk about doing that on Twitter and LinkedIn after the video. I want to flip the script a little bit because you originally wanted to interview us, which was very kind of you, but all considering, I don't think we're that interesting in light of what you're going through. But feel free to, if you have any questions about us and our business and how we can help, happy to shed some light to the viewers.
Thanks. Well, I actually do have my series of digital health interviews with tech influencers and startup founders in digital health. And I was really excited to talk to you because I know that you have lots of experience and expertise in digital health specifically. And you have the company eVira Health as well. I'd like you to tell a little bit about the company so we know what's going on. And maybe just a little bit about your background and how did you get involved in digital health?
Yeah, Irma, did you want to start?
Yeah, sure. So I'll start first with my background. So I'm actually a software engineer myself by training, and I worked as a software engineer for 14 years or so here in the US. After I got my my first master's here in systems and software engineering, and very interestingly, my first full-time job was in the medical devices, medical software area, and that's when I first developed this this passion for the space because it was actually very interesting and very rewarding as a young software engineer to get to see how my work literally impacted people's lives. I was lucky to work on radio surgery, treatment planning systems, because we were a startup here in the Boston area. I got to work with neurosurgeons and medical physicists and install our systems in hospitals and train the doctors and got to really see the impact of the technology that we were pioneering and developing on lives of patients. So that's where my passion really started. And then it just so happened that while I was working at the company, I had some close family members that were going through a lot of health challenges. So I started to be a patient advocate, which is the work that I continue to do to this day. So this has been 30 years of patient advocacy. And while my professional career had shifted and I went to other industries and ended up spending about 20 plus years in product development, a variety of different roles, my connection to healthcare and passion for the patient experience and for the use of technology to help both patients and the clinicians to the goal of better clinical outcomes, which is what everybody wants who goes to in healthcare. That's why physicians become physicians, nurses. Everybody wants to help the patient, and so and then parallel to my patient advocacy and being in product development, I've also got involved with storytelling and coaching. I've been coaching TEDx speakers in storytelling for years through the TEDx conference that I've co-founded here in the Boston area. And then I've expanded that to coaching entrepreneurs to help them deliver pitches at competitions and basically help them tell their story. So this is the skill set that now I bring to eVira Health with Evan. So deep technical expertise, experience, patient advocacy, community building, and storytelling. So I'll throw it over to Evan for his very complementary, different experience and background than I have, and then we can come back and talk about what we do at eVira Health.
Yeah, so I've been a tech geek my whole life, and the last number of years a tech influencer / content creator, industry observer, and have built a huge audience on social media. But until I had Irma, I was really one of those people who didn't like going to the doctors, intimidated by medicine and health, and was just, don't ask, don't tell was my philosophy on healthcare. But through, meeting Irma and learning about her work as a patient advocate and her advocating for me in some cases, and then seeing the rise of technology in healthcare, whether it's, the Oura Ring I have, or the Apple Watch, or the even the glucose monitor I wear to monitor sugar, or all kinds of tech attached to my body, I realized, wow, this is a real beginning of a revolution. And as a tech geek, it felt really natural to jump in and explore this space and explore the intersection of tech and healthcare and gadgets, and take ownership, to some degree of my health and be more educated. So that's been just a fantastic ride the last 5-6 years. And then turn that journey with Irma led us to working with amazing clients in this space, from 3M Healthcare and big data analytics companies like InterSystems and Microsoft and others. And so we're just industry observers, but we're also like patients. So we have an independent voice. We're not affiliated with any organization, and we can just talk and tweet and blog and video chat like we're doing now about topics in health. So it's been a fantastic, interesting journey, and it's only accelerating now, the adoption of health tech in our lives. So what about you, Alex? How did you get interested in healthcare, of all things?
Before I got into IT, I was working in the NGO, which was covering lots of topics related to HIV/AIDS, and I was doing public relations in that field. We helped to get the treatment to prisons, which was never there before for HIV patients. We did lots of press conferences and advocated for the rights of HIV positive people. So I got into healthcare within the NGO I worked for. And then when I moved to IT, somehow it worked out that most of the projects I got in the very beginning and then later on were also digital health.
Fantastic. Well, congratulations on that journey.
Thank you.
I'll go back to eVira Health and talk a little bit more about what we do for clients. By the way, you mentioned American Heart Association. They are also one of our clients, so we have some of those in common. So eVira Health, we're a boutique B2B social marketing, digital marketing consultancy. So we focus exclusively, now work together, we're focused on working with clients exclusively in life sciences, digital health, health tech, healthcare space. And what we do for clients is a combination of things. So obviously it's social media strategy and implementation support. And it's also content development. So Evan mentioned that, like videos like this, but also long form content, like blog posts and deep dive articles, etc. And then it's content in the form of LinkedIn and Twitter posts, as well as promotion of their content, so content distribution, amplification. We also are really great at covering events. So we've been doing that now for many years. And with COVID, as you mentioned, everything had changed. So how we do work in general changed, how companies approach their own marketing, what happens as conferences have changed. So we've gotten really good at covering in-person events as well as virtual conferences. And we also found a formula of doing a hybrid, covering an in-person event while not even being there. And that's is helped a lot of companies who themselves are not necessarily at the conference, but want to have a share of voice on conference hashtags and to kind of tap into the audience for a particular conference, like huge conferences we have here, like HIMSS or CES, Digital Health, etc. And what else am I forgetting, Evan, in terms of what we do for clients? And yeah, there's coaching and guidance and mentorship and sharing best practices, helping people optimize and manage their corporate handles, but also personal handles of company executives. Evan can tell you from being on social media for 10 plus years, people want to do business with people. And there's, even at large companies, it's very important to personalize and to have the people and personalities come through. And so we've been advocating for people to have their own personal presence and not just hide behind the corporate handle. Evan, what did I miss in terms of?
No, I think you covered it all. And Alex, I was really impressed to hear about your digital health interview series. We'll have to take a look at some of the interviews, and also we can introduce you to lots of folks who would love to join you and do an interview. And I think that's really the future. We in marketing is all about storytelling and content creation, and the future belongs to content creators who can communicate at a human level. So what you're right on track. The old days of PR, you talked about PR, press releases, and handshaking at industry events. I mean, that'll continue to some degree, but the future is digital and social media is a phenomenal destination for all things now. I mean, I wake up every day and the first thing I look at is TikTok and see what's happening in Ukraine, because you get reporting and stories in the field that you don't get anywhere else, or on Twitter as well. And yeah, so keep up the great work.
Thank you. I wanted to ask about eVira Health. You've mentioned some big names, some big corporations, but do you also work with startups, with startup founders in digital health?
Yeah, we do a lot of work with companies who, frankly, aren't getting their fair share of voice on social media. Many startups, even larger ones, are surprisingly, are lost on the noise on social media and don't get the attention and engagement they kind of deserve because it's a new brand, or it's just so noisy on these channels. And a lot of the traditional organic reach has sort of died. So you have to use the latest best practices, tips and tricks, and video like we're doing now, and audio and multimodal content to really generate excitement and awareness and drive engagement. But frankly, even the big tech brands aren't particularly good, many of them, at social media. They're very buttoned up. They don't really know how to have much fun or make content that's really compelling. And so, collaboration is the name of the game these days.
We actually love working with startups. We talked about kind of personal reasons for getting into the space and the passion. And that's what I find through all my work in the space, is that there is always a why behind a founder or co-founders or executives at the company, at startups in healthcare. So it's very fulfilling to work directly with people who were so driven and so passionate about the space to actually start a company. And oftentimes, as it is with me, founders have either direct personal experience with the healthcare system, or it was somebody very close to them in their family, a family member that showed a big problem that needed to be solved, and then they basically put their money where their mouth is and started to work to solve the problem. So in digital health, obviously, there has been a huge explosion of investment in digital health over the last several years, but there is also some talk about how digital health might be a bubble, how a lot of the solutions might be looking for a problem to solve. So we're yet to find or work with a startup where they have a solution that's looking for a problem to solve. Every startup we've been working with, the founders have seen the problem, have dealt with it, and then they came up with a solution that is solving that specific problem. And that's actually, that is very important, because being an engineer myself through and through, I know how technology is often focused on technologies, and engineers focus on the very cool technology that they want to work on, and so and then we actually advise. In my coaching practice, I advise founders to have to bring in other stakeholders in early in the process, so that they can have real-time validation of that what they are building and the solution they're building is actually going to work in the real world. So, so I think that's an important aspect, and then working with startups, because they're nimble, they're hungry, they're really attacking some areas that really need solving, and then they're innovative, and then they don't know yet that potentially don't know yet that healthcare is just so complicated and so hard, but they think that they can break through and they can make change in this systemic healthcare system. And then that's where we help them get that voice amplified and break through the noise and get there.
And Irma, you've worked with a lot of doctor entrepreneurs as well, which I know you find particularly gratifying, because they're day to day, they're really helping patients, and then like at night they're building some contraption or app or device to help even more. So it's like super duper helpers. What's that been like for you?
Yeah, absolutely. Love working with people in the front lines of healthcare, and it's just been also heartbreaking to see just how much the profession had suffered through COVID, just because they've been so strained, and there's so much being asked of them, while the healthcare system overall, obviously we're sitting here in the U.S., known as the best healthcare system in the world, except it's not always the best. It's not always the best in every possible way. So there is absolutely challenges that we have here, and it's often falls to physicians, providers, nurses to kind of fight there on the front lines without necessarily all the support. So COVID's been a really a big challenge, obviously, for patients who had to postpone their cancer screenings and not get the right care, either because they're scared or just the appointment's not as available. But of course, the healthcare personnel has been under huge strain. We've had a lot of resignations. There's yeah, so it is gratifying to work with people on the front lines, but I also appreciate and see the additional strain and challenges that.
And speaking of challenges, Alex, I can only imagine being a nurse or a doctor or EMT in Ukraine. You've got patients on one hand and your family on the other hand, and another hand, you're in combat in some capacity. I mean, you must know so many providers who are in this awful predicament.
I do know several doctors. I talk to them once in a while. This is definitely, I mean, they're definitely heroes working 24/7 right now, especially in the cities close to the war zone. And I cannot even imagine. There are some doctors in Mariupol right now, which is blocked by Russians for like more than 2 months. Those people are definitely heroes, and I wish they all survive and gonna bring some impact and help develop digital health as well in Ukraine at some point.
Yeah.
I wanted to ask you a question, since I guess I've missed some of the news from digital health due to the events happening right now. But the pandemic definitely brought a lot of boost for digital health in the world, and 2021 was huge in terms of number of startups appeared, number of investments, of course, that got into the field. But the first quarter of 2022, there's a drop on 36%, according to CB Insights. Like Fintech and retail tech sectors only saw 18 and 11% funding decrease respectively. So what's going on your perspective? Why there is a drop in investments, a significant drop compared to other industries? What do you think?
Yeah, I think part of it is structural. We have a system that's quite rigid, with regulations around doctors and how they work and bill for services and support patients. Some of those regulations were lifted during COVID, and some of them came back. And you know, my physician, for example, doesn't do telehealth calls anymore. He gets all in person, and some of that is personal preference based on billing and other practices. So yeah, it was disappointing to see some fallback in telehealth adoption and deployment as we get back to the quote unquote real world. What do you think, Irma?
While it is something to notice that there is a drop, significant drop in funding, I wouldn't be alarmed just yet, because I think it could also be cyclical, because when there was this huge increase in funding in 2021, as you mentioned, it might be natural for investors to actually want to take a stance of like, okay, well, let's see how things are doing with that huge inflow of cash and so many new startups, like you said, on the scene. So, you know, I think there is a little bit of pendulum effect sometimes that we see. I see it a lot in this country, for example, with a lot of things, including regulations and policies. So sometimes we seem to go to one extreme and then, you know, correct and go to the other extreme. So I think it's somewhat natural. And also I think that, you know, with the pandemic, even though we're basically two plus years into it, I think there is reassessment in terms of, okay, so are we still in the pandemic? Are we trying to get back to the new normal? So I see the shift to a combination of, let's say, in-person and virtual visits. So I think what would be very good is, as a result of the pandemic, one of the outcomes would be if we really built in telehealth and virtual visits as part of the overall system. So it doesn't have to be either or. I think a combination of these technologies, of bringing them when it's just right, would be a very good outcome. So there may be some of that expectation in the industry that, okay, well, pandemic is over, so is telehealth all done now? And I think there is, not really a battle, but there is some figuring out of what the right level of this remote health technology is, even if we are back to new normal. So as a patient myself, as a patient advocate, I am very active in kind of patient communities and advocacy communities. So we really, really want continuous support and coverage of telemedicine services, including voice only, audio only coverage, which is a big kind of point of contention, I guess, in the US here. It seems like it's not guaranteed that it will be covered or covered at parity with video visits, while we think there is a big role of audio only to play, not just because, well, actually in large part because of broadband issues. You might be surprised to hear that in the US, such an advanced country, there is actually a lot of broadband issues. We have a lot of rural communities and areas where broadband access is not there. We have a lot of people who don't have the right technology to actually have a video visit. So we see audio only telehealth as health equity concern and access to healthcare issues. So I think we will settle that understanding of the virtual and in-person, how that can all combine in a post-COVID world to better benefit patients and still give doctors the right level of reimbursement for their services. So I'm still bullish on digital health overall. But I think there has to be some consolidation as well, because as you've mentioned, there's so many startups and so many, but there is some redundancy. So there's many providers solving this, providers of technology, solving the same problem. So there has to be some consolidation for the sake of patients as well, because there's so many apps. As a patient, how do you know which healthcare apps to use? Who's going to be around? How can you download one app that can actually address a lot of various healthcare concerns and be kind of your digital health sidekick, as opposed to having 10 different apps? Evan, you mentioned, the Oura Ring, the Apple Watch, the continuous glucose monitoring. So there is some integration between different apps that you can get through, let's say, Apple Health app, but most of the time these are all separate things, and then the onus is on the patient to try to figure out how to present these data to the doctor or make sense out of the data into some actionable insights. So so I think there's going to be more funding, but some consolidation.
And the bright spot, I think, that doesn't show up in just the funding numbers is big tech. The big tech players are really doubling down on healthcare, and they've had false starts and missteps over the years, but all of them, from Google.
I used to work for Google for 5 years.
Yeah, speaking of healthcare missteps, but they're not giving up, and they're doubling down, from Amazon to Google to Microsoft is a huge push, and the rest of them. And so those numbers are real, and the R&D, the investment, and the partnerships they're making will come into fruition over the next months and years. And so that should be a big boon for consumers.
Well, I think that was very important to hear for startup founders what you said, and that it's a natural process. That there is no need to panic that money is going out of the industry, so let's stop developing great products there. So I think that's important.
Keep calm and carry on is what they used to say during the Blitz. Easy for us to say here in the safety of the U.S.
Exactly. Yeah.
We do. We want to check base, Alex, in maybe 30, 60 days and check in with you and see how things are going personally and professionally.
Yeah, love to do that.
All right, everyone. Well, thanks for reviewing. And again, you know, our wishes and prayers, etc., are with you and your family and countrymen. So
be safe, Alex, you and your family and everyone there.
Only Ukraine. Bye-bye.
Slava Ukraini.
Героям слава.